that is a groundbreaking milestone for our Kenyan health sector, especially with regard to the management of cancer. Over the last 8 years, we have steered our country, Kenya, closer to a new reality where every person has access to quality, affordable health care. And today, we add yet another arrow in our quiver in the fight for universal health coverage, a priority for my administration as one of the pillars of our Big Four agenda. The scourge of cancer, as we all know, has bedeviled our nation for decades. The financial burden of cancer has added to the physical and emotional burden of this disease, forcing many families to seek diagnostic and treatment services outside of Kenya. This integrated molecular imaging center is the first, as we have heard, of its kind in a public hospital in Kenya, but also the first of its kind in the Eastern African region. This facility is part of the Kenyatta University Referral Hospital Comprehensive Cancer Care Center, and it contains world-class equipment that will help transform our national and regional response to the unyielding threat of cancer. We as a country and as a government are making these investments in recognition of the fact that cancer today is the third leading cause of death in Kenya, and projections show that the burden of this disease will grow by approximately 85% by the year 2030 unless we as a government take bold steps to address the challenges related to this disease. Key amongst cancer challenges is early diagnosis and accurate stage grouping, that is to say, stage 1, stage 2, 3, or 4. And with this local facility, patients will no longer have to travel abroad to get accurate cancer diagnosis and quality cancer care. I wish to assure all Kenyans that the doctors, the specialists we have here, the equipment and services are now at par or better than those found in the countries that historically Kenyans were traveling to for diagnosis and treatment. Today we have heard that there are already patients who have undergone diagnosis here at the Integrated Molecular Imaging Center. And I am glad to note the impact of this intervention in their livelihood. So today we know that outward medical tourism, especially for cancer care, results in Kenyans spending approximately 10 billion shillings every year abroad on early and accurate diagnosis and subsequent quality treatment. Additionally, and of great concern to me, is the fact that not every Kenyan citizen can afford to seek services in hospitals outside Kenya, meaning that those with cancer often have late diagnosis and treatment. When cancer diagnosis is delayed or inaccessible, there is not only a chance of survival, but also increased complications in treatment, leading to increased cost of care. So early diagnosis, as we have heard, is therefore an integral part of improving cancer care management. As a government, we have invested a lot in health, equipping health facilities, training healthcare workers such as nurses and doctors, as well as other healthcare professionals. In addition, we have also invested in the construction of additional public health facilities and also undertaken the reform of the National Health Insurance Fund. All these efforts are to ensure that Kenyans access quality and affordable health care here at home. Ladies and gentlemen, the government has launched several initiatives specifically addressing cancer care. In July of 2020, we launched the new cancer control strategy, and additionally, the Ministry of Health has also proposed a nationwide lifestyle modification campaign. To fortify this intervention, we also rolled out the Breast Health Awareness Campaign, which aims to improve access to breast cancer care in our country. In Kenya, breast cancer is the most diagnosed cancer and has annual incidences of 6,000 new cases and 2,500 related deaths every year. In response to this and working closely with county governments, we have also established 10 fully functional county-level chemotherapy centers, ensuring that treatment is available in several counties, and these include, amongst others, Mombasa, Kisumu, Kakamega, Garissa, Nyeri, Nakuru, and Meru. We have also developed and disseminated the National Cancer Screening Guidelines to all counties, and we continue to encourage screening and provide annual cervical cancer screening services. And we urge all eligible women to take advantage of the healthcare facilities, which include maternity and nursing homes, level 4 facilities, such as the sub-county hospitals, county referral hospitals, and level 6 facilities.